Hi, my name is Mary Posey, and I live in southern Maryland. And back in November, I was having a lot of pain. I was at the point where I just didn't want to live. I was in so much pain, and I was depressed because I was in so much pain. And plus, my husband was getting ready to retire. He will be retired in 3 months, and I knew that we couldn't go anywhere because I couldn't sit in the car. I sing twice a week, and I'd gotten to the point when I would be rehearsing, I would be in so much pain that I would have to get up with my music and walk to the back of the room and walk back and forth to sing. I'd also had a heart attack in 2007, and my blood results, I call them inflammation markers, were extremely abnormal, and I didn't know why. But about 2 years ago, I discovered I had something called Polymyalgia Rheumatica, or PMR, and it is an autoimmune disease or disorder very similar to fibromyalgia. So I was on prednisone for a while, and then that made me not only gain weight, but that also has really bad side effects. So I went off that, and I went on another drug called methotrexate, which is used for chemo patients. That helped the pain, but it started to come back again, and I just had a lot of issues that I just was having a hard time living with. I had acid reflux, foot pain where I could not walk very far, and I'd gone to 4 different doctors, including a podiatrist and a neurosurgeon. Nothing was helping. So I knew about this friend from church who had this machine, and I called her one night after choir practice, and I said, please let me come and just try it. I'm ready to do anything right now. So I went to her home, and that night, after I laid on the machine, on the pad, that night I went home and I was so relaxed that I didn't even bother to take my Ambien, which is a sleep medication, and I had been on it for 14 or 15 years, and I just didn't take it. I just went to sleep. And that's the first time in 15 years that I had missed a dose, on purpose. I mean, I just stopped taking it. Not a good thing to do because you can have pretty serious side effects, so please don't follow my example. I had spasms about 2 weeks later, but I didn't have the seizures which can come from a withdrawal of Ambien. By the 1st of January, I was due to have a back surgery, a minimally invasive laminectomy, but my spasms were pretty bad, and so we changed the surgery date. By the middle of January, my pain was so much better. I'd stopped taking 5 medications, including 1 for acid reflux, the pain medication, the methotrexate for the polymyalgia. I'd stopped taking the Fosamax, which is for osteoporosis. I just didn't want to take it anymore. I didn't like the side effects. But one of the most exciting ones, which is a little personal, was I was able to stop taking a medication for an overreactive bladder. And I'm at the stage now where I can go for 2 or 3 hours in the car, driving without pain and without stopping at least 3 or 4 times to go to the bathroom. And I'm able to swim for at least an hour without having to jump out of the pool and go in and go to the bathroom and get back in the pool. So that's one of the more exciting ones for me personally, that I don't have to take that anymore, and I'm able to go for a long period of time. So I can't say enough about the Beamer. It certainly has changed my life, and we're looking forward to retiring in about 3 or 4 months. I'm back at work again. I wasn't working for 15 years, partly because of the pain, and now I'm working a few hours here and there until we retire. I haven't quite retired yet, so I'm looking forward to being able to ride in the car without being in excruciating pain and having to stop every hour or so. So I would highly recommend it if you want to feel better and get your life back. Highly recommend using it.
And recently you had a blood test before and after. Could
Yes,
you share a little bit about?
The 2 blood tests that I had done, because I work in the lab, I got them run one day, and they are inflammation markers. For anyone who's technically oriented, it's called a C-RP, which is a C-reactive protein, which is always high in someone with a heart attack, or the PMR, fibromyalgia. The C-reactive protein is very high. Mine was like 10 times normal. And I also had an ESR ran, which is a sed rate. It's a sedimentation rate of the red cells, also an inflammation marker. And the first time in 9 or 10 years that both my ESR and my CRP has been within normal limits. So that means that the proof is in the pudding. In this case, the proof is in the blood. So my blood is showing that I do not have the inflammation that I had for so many years.
Thank you so much.
Thank you.